morning. My name is Rouse, and my disease is yellow fever. What is yellow fever? Yellow fever is a serious, potentially deadly infectious disease caused by a virus that is spread to humans by the bite of an infected mosquito, Aedes aegypti. This disease is not curable. Where is it commonly found? In Africa and South America. The yellow shows the yellow fever endemic zones. The history of yellow fever. It was started by U.S. Army physician James Carroll after he gave him his own life by allowing a mosquito to bite him on August 27, 1900. His actions helped his colleague, Walter Reed, prove that the mosquitoes transmitted the disease. It is noted that in 1881, Carlos Finlay was the first to propose that the mosquito transmitted the disease, but he was unable to prove it. The first evidence of yellow fever in America was the Mayan manuscripts, describing outbreaks in Yucatan and Guadalupe Bay in 1648. Yellow fever endemic struck the U.S. repeatedly in the 18th and 19th century. The last major outbreak in North America occurred in New Orleans in 1905. The yellow fever virus was the first human virus discovered. The symptoms of yellow fever. Once an individual has contracted the disease, it is considered the incubation period, lasting 3 to 6 days. When this incubation period has ended, they enter the acute stage, also known as phase 1. Symptoms may include fever, headache, muscle aches, and dizziness. These symptoms usually improve and go away within several days. 15% of the patients with yellow fever enter the final toxic phase, also known as phase 2. Symptoms are made up of the acute phase, but are heightened more severe and life-threatening. There are also new symptoms like vomiting with blood, internal bleeding, shock, jaundice, and eventually multi-organ failure, which leads to death. 50% of the 15% will die within 7 to 10 days. Yellow fever can be misdiagnosed for severe malaria, viral hepatitis, and other diseases. Treatment and prevention. There's no cure for yellow fever. In the beginning, no one really knew what caused the disease. People tried all sorts of strange remedies as a cure. They burned barrels of tar in the streets to disinfect the air, sprayed sulfur and lime mixtures into the homes of the infected, and they isolated the sick. It was Max Wheeler who developed the yellow fever vaccine for prevention. Treatment is aimed at reducing symptoms and making the patient as comfortable as possible. The demographics of yellow fever. Yellow fever is most common and widespread in 33 African countries and 11 South American countries. Nearly 1 billion people live in the area of the world where the disease is common. Anyone can get yellow fever, but the elderly have a higher risk of severe infection. Unfortunately, immunizations in Africa and South American countries were discontinued in the 1960s, and the disease came back in the 1980s. Studies show that mass vaccination campaigns are needed to control the disease. The transmission types of yellow fever. There are 3 transmission types: sylvatic, intermediate, and urban. Sylvatic occurs in tropical rainforests where monkeys infected by mosquitoes pass the virus onto other mosquitoes that feed on them. These mosquitoes, in turn, bite and infect humans that enter the forest. Intermediate. This occurs in humid or semi-humid savannas of Africa. Semi-domestic mosquitoes infect both monkey and human hosts, and increased contact between people and infected mosquitoes leads to transmission. Urban occurs when infected people introduce the virus to densely populated areas. Domestic mosquitoes, most common Aedes aegypti, carry the virus from person to person. Mortality of yellow fever. It affects an estimated 200,000 people per year. Estimated 30,000 deaths in the tropical regions of Africa and South America. It's not just restricted to those areas where the disease is endemic, but is reported by fatal cases among tourists who have traveled to forested areas without yellow fever vaccination. Yellow fever experience. Abstract. The Journal of Infectious Diseases produced an article entitled Experimental Yellow Fever Virus Infection in the Golden Hamster. It attempts to develop a new alternative experimental model to replace human corpses and monkeys. Researchers were seeking an up-to-date method of studying the yellow fever virus from its onset throughout its disease, life ending in a cure or death using hamsters. Materials and hypotheses. Materials. The experiment used 4 to 10-week-old female golden hamsters and 2 strains of the yellow fever virus over a 10-day period. Hamsters infected with the yellow fever virus and tested can be cheaper and easier replacement model than the more expensive and highly regulated monkeys will be when studying the virus. Procedure. A single hamster was injected with a strain of the yellow fever virus, and on the 3rd day, the hamster was killed. A portion of the liver was removed and preserved. A portion of the liver that was preserved was injected into another hamster. This procedure was repeated 9 times. All hamsters were inoculated with 1 milliliter of respective yellow fever virus. After infection, blood samples were obtained in daily intervals from the cycles. Some of the blood samples measured the level and duration of the infection and the hamster's immune responses. The results. Research was considered primarily, and results were treated as data to be added to the studies trying to erase the lack of data on the yellow fever virus in humans. Similarities were found between the yellow fever studies with hamsters and those studies with rhesus monkeys, the common preferred animal for studying the disease. Differences in the study showed the rhesus monkey gets the yellow fever virus and it progresses faster with the most likely result to be death. Adult hamsters infected with the virus survived infection and had similar findings to the yellow fever virus found in humans. Conclusion. The researchers believe that their data show the hamster model may be a better model than the monkeys for studying yellow fever in humans. The hamsters were also cheaper and easier to work with than monkeys. The hamster model proved to be a possible alternative research treatment when studying the yellow fever disease. The social effects of yellow fever. Infected people will somewhat get shunned and unable to interact with people as they once did, even though the disease is not contagious. Due to the symptoms, most people chose to protect themselves from yellow fever by avoiding infected people. Many people, including tourists, stay away from areas where the mosquitoes thrive the most. In Africa, many African people stay isolated and within their uninfected villages. Key facts in review. The yellow in the name refers to the jaundice that affects some patients. Jaundice is liver failure, and this can lead to the yellowing of eyes and yellowing of skin, as you can see in these 2 pictures. Up to 50% of the severely affected persons without treatment will die. There are an estimated 200,000 cases of yellow fever causing 30,000 deaths worldwide each year, with 90% of it occurring in Africa. Vaccination is the most important preventive measure. Use of hamsters may be a better alternative research model to studying the disease than the monkey because they are cheaper and easier to work with. In conclusion, a cure for the yellow fever disease has yet to be discovered. However, through continued research like the hamster experiment and vaccinations, hopefully this mystery can be solved. Am I work excited? Any questions? Maya. You said
When the yellow fever is originated from mosquitoes,
okay, so yes. So the virus can transmit from mosquito to mosquito, and then once they go on to transmit to humans. Chris.
You said 1905 was the last one year outbreak, right?
Yes, you go.
So what are they doing in Australia?
Pardon?
What are they doing to keep the outbreak in 16?
Well, we keep the vaccination going. Like I said, vaccine below the vaccination. By doing this, they have to stop yellow fever outbreaks. So, does that answer your question? Mongoose.
the army doctor that discovered it, when he let himself get bit by a mosquito, did he die?
Yes, he
in the
did.
experiment?
What is the stop infecting mosquitoes from dying around the world on a worldwide outbreak?
There's really nothing to stop the mosquitoes from going around. It's just that they just have the vaccinations to keep it. Once you keep the bugs away, so there's nothing that can really stop it. It's just that you have vaccinations to help protect you. The vaccine will not last your whole life, but it does last for a long time.
You mentioned that 15% of people with yellow fever make it to the toxic phase. What happens to that other 85%?
Okay, so yellow fever, like I said, is potentially good. So once you have yellow fever, you'll just have it until they find a cure, which is like not happening. So that 85%, they'll just have yellow fever, and they'll continue with the symptoms that are in the acute stage.
So will they die or will they just?
No, they'll just live until like the eventually die of like 80 or something like that. Does that answer your question?
So, other than vaccinations, are there any other preventions for this disease?
No. James.
I have two questions. So, can you tell like if a mosquito is infected or not?
No, because you cannot tell until probably maybe like it's too late until like, you go to the doctor or something. You might have to look physically misdiagnosed. Like I said, for viral hepatitis or severe malaria, it can also be misdiagnosed for like just a regular virus, which is bacteria. This incubation period, that's not doing anything. So just it's in your body for 6 days, so you can't really tell.
Okay, and so then like the guy who discovered it, who got the mosquito bite, how did he know that that mosquito has the disease or like that specific mosquito?
Okay, so once the mosquito bit James Carroll, his colleague Walter Reed, he did a sort of a little experiment to get back to him on like what exactly he did, but that's what he did.
Like how did they know which mosquito to use?
Well, okay, so they went to like since the disease is like in South Africa and South America, they went. Actually, I'll get back to you. Josh.
Out of all the people in the world, how many people like actually get the disease? Like,
I will get back to you that, but it's very limited since it's only in Africa, Africa and South America, and there are vaccines for it. So when people do go to Africa, they get vaccines.
I see a quick question.
Yeah.
Like, how common is it in the U.S.? How common?
It's very rare. Like in Africa, I mean, they just happen to have a mosquito, like a mosquito. If a mosquito just comes all the way to America, that doesn't happen. But that's all.
Yeah, I see.
Corey.
So you're saying that like the occurrence of the mosquito is not the same much anything like the daily mosquito has white stripes and spikes?
Pardon?
You're saying that the appearance of the mosquito does have any distinct marks or anything?
No, unless you look at it very, very closely with microscope or you get like dissect and stuff. That's the only way you can tell it to different from other mosquitoes. Okay, one more question. Maya.
Would it be possible for someone who has yellow fever to like get it in Africa and the United States and then like spread it here?
Well, no, it's the only way you can track is you can go from person to person is by mosquito. So like I said, it's not contagious. So like if you like it doesn't actually touch, hug, you sleep with someone, you can't get these unless a mosquito bites you. Thank you.
All right, jazz hands for Walter. Okay, William.